You show up to therapy, you process your past, identify your triggers, and reframe your thoughts. You do the cognitive work. Yet, despite having complete mental clarity, something still feels completely stuck. You might know you are perfectly safe now, but your chest stays tight. Your digestion remains knotted with anxiety, and you still can't sleep. Modern therapy is highly effective at using language and reflection to process trauma, but talking doesn't always release the physical footprint that prolonged stress leaves behind. Emotional distress operates on two fronts. It is processed by your mind, but it is carried by your physical body. This is where traditional Chinese medicine, or TCM, offers a different lens. Rather than starting with your thoughts, it acts as a bottom-up approach, targeting your physical symptoms. A TCM practitioner focuses on regulating your physical systems, your circulation, your breathing, your digestion, to build a more stable internal foundation. By unblocking those physical tension points, your nervous system can finally settle, and a quiet, regulated body gives your mind the actual space it needs to do the heavy psychological work. Centuries ago, the foundational text of Chinese medicine, the Wang Di Neijing, mapped out exactly how this mind-body connection works. The text establishes a concept called Xing Shen Hei Yi. This translates to the unity of physical form and inner spirit. Under this framework, emotions are not treated as abstract thoughts floating in a vacuum. They are viewed as active forces that directly manipulate your physical biology. Trying to resolve a psychological burden while ignoring its physical symptoms goes against the reality of how the human nervous system actually operates. To see how this works, look at this map of the human body. In TCM, prolonged unresolved emotional strain actively disrupts specific organ system balances. For example, grief directly impacts the lungs. Unresolved sadness often manifests physically as chronic breathlessness and a heavy, tight chest. Chronic worry shows up in the spleen and digestive system. That constant overthinking leads to digestive discomfort, nausea, and a feeling of physical heaviness. Intense anxiety or agitation strikes the heart. Racing thoughts translate straight into physical palpitations and disrupted sleep architecture. These physical responses, the shallow breath, the racing heart, the digestive knot, are the measurable ways the body maintains a state of distress. They require physical regulation to return to a baseline of calm. The TCM framework views this systemic biological disruption as the physical manifestation of the mental experience. While a psychotherapist helps you process the origins of your trauma, a TCM physician works manually to regulate your qi, restore blood circulation, and release physical tension. By placing targeted acupuncture needles along specific meridians, practitioners can prompt the nervous system to physically reset. They support this by prescribing specific herbal formulas designed to repair your internal foundations, like your digestive balance and your natural sleep cycles. Addressing these somatic symptoms can lower the body's overall state of alert. When the physical environment of the body is more stable, you may find you have more emotional capacity to engage with the insights gained in therapy. But we need to set clear expectations. Traditional Chinese medicine is not a magic cure-all for severe mental illness. The strict rule of integrative care is that TCM serves solely as a complementary support system. It is never a replacement for modern psychotherapy or psychiatric care. You should never alter or stop prescribed psychiatric medication without direct supervision from a medical doctor. True integrative medicine is about adding targeted support for the whole person. It is not about abandoning evidence-based medical science. To combine these approaches safely, you need radical transparency. Tell your therapist exactly what TCM treatments you are receiving, and inform your TCM physician about your therapy and any medications. Then divide the labor. Lean on your psychotherapist to track your cognitive insights, process your trauma, and navigate your relationship patterns. Let your TCM physician track your physical foundation, your sleep quality, your digestion, your daily energy levels, and your muscle tension. When you hit that wall in therapy, remember your healing journey does not have to be an either-or choice between the mind and body. True recovery is a whole-person endeavor. It honors the mind that understands your pain and the body that has carried it all along.